Hey everybody, Will Martin here. So I've got a journal article from Bloomberg Business Week that I just came across that I want to share with you. And this has to do with nurses who are being imported from other countries, in this case the Philippines, and are being brought to the United States to work in understaffed hospitals. So let me share this with you. And it's entitled, From Bloomberg Business Week, Nurses Who Face Lawsuits for Quitting or Fighting Back. And the bottom line is that the nurses are apparently being hired on 3-year contracts, 6,240 hours, which would equate to 2,080 hours a year, which would be a full-time contract per year. But apparently their first 3 months of working don't count towards that 6,240 hours because the staffing agency apparently considers that to be orientation. In this case, this nurse felt trapped. She was mandated to work overtime, and the overtime didn't count towards the 6,240-hour contract. Her shifts stretched into the 16-hour range in the emergency department, which is no surprise. That happens a lot. But she felt trapped, and in order to get out of this contract, she had to pay a $20,000 quitting fee. So she's now suing, and she filed a proposed class action in Health Carousel's home state of Ohio, accusing the company of human trafficking. Although trafficking evokes images of people brutally beaten or chained, according to the article, the legal definition is much broader. In June, a U.S. district judge rejected Health Carousel's motion to dismiss the case, and at the end of last year, this nurse added claims of wage theft and racketeering, and apparently 2 more plaintiffs joined her. So Health Carousel, the staffing agency, has denied any wrongdoing. We're proud of our work to place internationally trained nurses in understaffed hospital systems in the United States. I have no idea if this is being used in the hospital I work in. I mean, it could be. I don't know if that's something that's going on pretty widespread. If it is in your hospital, let me know. I'd like to hear about it. It says in the article, more than 500,000 workers in healthcare and related fields quit in December, according to the U.S. Department of Labor. And that number might have been significantly higher if not for the legions of employees contractually restricted from resigning. Americans have gotten used to calling healthcare workers essential. If Carmen's right, a lot of them could also be called captive. And this is an interesting graph of the monthly quit rate. Very interesting how that has escalated over time. Hundreds of healthcare employees have been sued by staffing agencies like Health Carousel for trying to quit or refusing work, according to U.S. state court dockets. Some sued the workers for trying to change their own visa status or trying to initiate mediation or encouraging coworkers to quit, or, as in the case of one worker in New York, having unexpectedly and surreptitiously left the apartment rented for him before abandoning work. It says here that staffing agencies tend to win these fights. This is all very interesting. The $30 billion medical staffing industry hasn't disclosed how many total workers it brings in subject to such contracts, but Health Carousel alone has said that it offers placements at the nation's finest healthcare facilities in all 50 states, and that its staff have helped roughly 7.7 million patients, a population as large as Arizona. Interesting. Here is registered nurses in the labor force. Very interesting here. Okay, so the bottom line is there are staffing agencies that are existing, and they're bringing in folks from other countries. And I invite you to look this up in Bloomberg Business Week and take a closer look at it. Interesting here, apparently this nurse's hourly pay was $25.50 an hour. Seemed less reasonable when she learned that lots of local positions paid more than $35 an hour. She later learned that UPMC, that's University of Pittsburgh Medical Center, paid Health Carousel $52 or more for each hour she worked, including the 3 months of orientation that the staffing agency said didn't count towards her 3-year contract. Carmen's ER unit was supposed to have 4 nurses caring for a dozen people, but often 1 or 2 nurses were missing for one reason or another. The low nurse-to-patient ratio was dangerous for both the nurses and the patients. So having a ratio of 4 nurses for a dozen patients, that's 1 nurse per 3 patients. I think that In the emergency department I work in, I think the nurses have a worse ratio than that. I think they're expected to be 1 to 4 or maybe 1 to 5, from what I've heard them say. After days of forced overtime, she felt guilty and worried, showing up to work exhausted. She was less alert. Her patients deserved better. Low staffing levels also meant Carmen's managers often told her to stick around after the end of her 12-hour shift. You need to stay because we can't keep the patients afloat. Well, this is very unfortunate. Carmen's lawsuit accuses Health Carousel of an illegal scheme to secure forced labor through threats of serious harm by threatening litigation, making nurses fear deportation if they're disobedient, and imposing those 5-figure penalties which the suit claims are calculated to scare employees out of quitting. An employer cannot create ever-evolving obligations in an effort to trap an employee into providing additional services. So it's very interesting. So I pulled up the website of the staffing agency, Health Carousel, just to take a look. We're driven by our higher purpose. Our work makes a difference in the lives of patients across the nation. And I guess that's it. Well, this is news to me. I wasn't familiar with this. And if you weren't, well, then we've all learned something here today. So the nurses that might be working next to you might be imported from another country. I'd like to hear what you have to say about this and what you think and what your experiences are. And hope to hear from you soon. Take care.